Hello, welcome to International Academy of Holistic Sciences. This is lesson 2 for Diploma in Sujok therapy. I will show you the locations of the correspondence points as per basic or original or standard correspondence systems for all the important body parts. So this is body, forehead is here. Then in the hand we have seen that this is the face. So this becomes forehead is this. Similarly, this is the temporal area, sides area. So this is the face. So this is the 2R temporal area. The nose right in the center. So here nose correspondence point is right in the center. Then eyes. These are the two eyes. You can just make out this on the face also. Ears on the sides, just like temporals, ears, 2 ears. Mouth, gums, teeth, all here in the mouth correspondence point. Larynx, lower portion of the neck, that is larynx is the voice box. Breasts, so this is the area as I told you, this protrusion under the thumb is known as chest area. So these two are the breasts. Heart, so this is the heart here and here this is the heart. This is the chest area, so it includes lungs, 2 lungs and heart. So this is heart. And here comes the lungs. Same. Then stomach, it is below the diaphragm. This is a diaphragm in the body. It is a membrane in the body which separates the chest organs from the abdominal organs. It exists in the body. So here stomach is there. So here we have taken this line as a diaphragm. This you will see later on also. So this is the stomach correspondence point. Then small intestine. This is the small intestine. So this is the lower portion. This is also a diaphragm line. So this is small intestine. Then this is appendix and large intestine. Appendix and large intestine. This is liver and gallbladder. Just touching the diaphragm, liver and gallbladder on the right side. Pancreas slightly on the left. Pancreas, this is the point. Navel right in the center. Ovaries, between the 2 legs, just up, little bit above the joint of the legs, 2 ovaries. So here in the hand, this is the correspondence point for ovaries. Because these two are the legs, so between the legs, slightly above, so this is the correspondence point. Then this is the for vagina and uterus, and for male it is prostate and urinary bladder. This is the kidney. Kidneys are approachable from the back. So they are on the yang side, below the diaphragm. See? Then occipital area, back of the head. It is on the yang side, where nail is there. So, back of the head. Now this is spinal cord, starting from here to this. But here, because our thumb is broken, the spine comes in 2 portions. This is one starting from here to here, then from here to here. This to this and this to this. This is the complete spine. Anus, joint on the back where 2 legs join, 2 hips join. So this is the back and this is the anus point. Then left hand and right foot. So this is the left hand. So this is the left arm. So this becomes the left hand and this is the right foot. Left hand and right foot. Then this is the wrist joint, left wrist joint and right ankle joint. So this is the wrist joint and this is the ankle joint. Wrist and ankle. This is the elbow and knee. So here is the elbow and knee. These are the elbow and knee joints. Then this is the shoulder, left shoulder, and this is the right hip. So this is the left arm, below this is shoulder, so left shoulder is there, and this is the leg, so this is the right hip. left shoulder and right hip. Endocrine glands. Endocrine glands are pituitary and pineal, then thyroid, and then thymus. Here also, pituitary, pineal, thyroid, and thymus. And this is pancreas. These two are ovaries or testes. Sorry, these are two are ovaries and this is testis. See, ovaries and single one is testis. And these two are adrenal glands. Adrenal glands are over the kidneys. So these are there on the back. These are there on the back side. This you have seen, I have already explained you. This is the left arm and this becomes the left hand. As I told you to divide the hand into two vertically, this will become left, this will become right. I hope you have understood this. Now go to joints. Joints are visible from the back, yang side. So this is the legs. So this is the hip joint, this is the hip joint. This is left hip joint, this is right hip joint. This is right shoulder joint, this is the left shoulder joint. Similarly now this is the left portion. So this is the left elbow and this is the left wrist. This is the left knee and this is the left ankle. Same way we can go to the right elbow and right wrist and right elbow and right wrist. Here is right knee and right ankle. Same is the true for the other hand also. Now you have seen spinal cord above in two portions. Here I will explain a little bit more. Spinal cord, one spinal cord is this. Now it is cervical portion is here. Cervical portion 1 to 7 vertebrae are here. Then 1 to 8 thoracic vertebrae are here. Then 9 to 12 vertebrae are here. And then comes the lumbar 5 vertebrae. Then comes the sacrum and then the coccyx. And here is the hip joint. So this is the detail of the spinal cord. Same thing is on the foot also. I will just written a few lines on the endocrine gland system because some of you may not be understanding what is the gland system, endocrine gland system. Your endocrine system includes all the glands in your body that makes hormones. These chemical messengers play a key role in making sure your body works the way it should. If your endocrine system is not healthy, you might have problems developing during puberty, getting pregnant, or managing stress. You also might gain weight easily, have a weak bones, or lack energy because too much sugar stays in your blood instead of moving it to your cells where it is needed for energy. So, key parts. Many different glands make up the endocrine system. The hypothalamus, pituitary gland and pineal, they are in the brain. The thyroid and parathyroid glands are in your neck. The thymus is between your lungs. The adrenals are on the top of your kidneys and the pancreas is behind your stomach. Your ovaries, if you are a woman, or testes, if you are a man, are in your pelvic region. You have already seen the correspondence above. Hypothalamus. This organ connects your endocrine system with your nervous system. Its main job is to tell your pituitary gland to start or stop making hormones. Pituitary. This is the master gland of your endocrine system because it controls the other endocrine glands also. It uses information it gets from your brain to tell other glands in your body what to do. It makes many different important hormones, including growth hormone, prolactin, which helps breastfeeding moms make milk, and luteinizing hormone, which manages estrogen in women and testosterone in men, which is useful in reproduction. Pineal. This gland makes a chemical called melatonin. It helps your body get ready to go to sleep. Thyroid. This gland makes thyroid hormone, which controls your metabolism. If this gland does not make enough, a condition called hypothyroidism, everything happens more slowly. Your heart rate might slow down, you could get constipated, and you might gain weight. If it makes too much, that is hyperthyroidism, everything speeds up, your heart might race, you could have diarrhea, and you might lose weight without trying. Parathyroid, this is a set of 4 small glands behind your thyroid. They are important for bone health. The glands control your levels of calcium and phosphorus. Thymus. This gland makes white blood cells called T lymphocytes that fight infection and are crucial as the child's immune system develops. The thymus starts to shrink after puberty. So its major role is only in the childhood. Adrenals, best known for making the fight or flight hormone adrenaline. These two glands also make corticosteroids. These are hormones that affect your metabolism and sexual function, among other things. Usually, its role is in emergency cases. When you are in a trauma, you are in a shock, accident happens, somebody has died close to you, near somebody has died, then you are in a shock, you are in a trauma. Then this adrenaline is produced by adrenal glands, and that keeps you alive, that keeps you normal working is possible only with those. And if there is not production of adrenaline not there, then you won't be able to fight that circumstance, that show. Then you will go in depression. You can go get into a coma also. Pancreas. The pancreas is part of both your digestive and endocrine system. It makes digestive enzymes that break down food. It also makes the hormones insulin and glucagon. These help ensure you have the right amount of sugar in your bloodstream and your cells. So pancreas produces insulin. Insulin makes the balance of the sugar in your body. If right quantity of insulin is produced, there is the right amount of sugar in your body. Now insulin is slow, less. Quantity produced by insulin, quantity of insulin produced is less, then it is not able to control the sugar. It will increase because it is not absorbing the sugar. So you will have sugar problem. In other case, if it is more insulin is there, then it takes up all the sugar. Then sugar level becomes low. That is also a problem for you. If you don't make any insulin, which is the case for people with type 1 diabetes, your blood sugar levels can get dangerously high. In type 2 diabetes, the pancreas usually makes some insulin but not enough. Ovaries in women, these organs make estrogen and progesterone. These hormones help develop breast capability, regulate the menstrual cycle, and support a pregnancy. Testes. In men, the testes make testosterone. It helps them grow facial and body hair at puberty. It also tells the penis to grow larger and plays a role in making sperm. So these are the functions of the endocrine glands given to you in short. Right, so I have shown you the correspondence point of the different body parts on your hands and feet. Now in the next lesson you will learn how to find exact point. Supposing you don't know the name of the organ, you can just find out that you have a pain here. You are just pointing out that you have a pain here, or on the back, or this side. Then how to find out that point also. That we will deal in the next lesson. So I end this lesson. Thank you.